Joining us for this specially extended EPI-WIN webinar on the topic of emerging zoonotic diseases and the One Health approach. For those new to EPI-WIN, we are the WHO Information Network for epidemics. With EPI-WIN webinars and the associated updates, our goal is to translate science in accessible, understandable, and relevant ways for evidence-informed actions and decisions in health emergency preparedness and response. Some housekeeping for today. The webinar is being live streamed on YouTube on our EPI-WIN channel, and the webinar is also being recorded and afterwards will be available from our website, and both these addresses will appear in the chat shortly. Interpretation is available today in French via the globe icon below. We invite you all to post your name, location, and organization in the chat box. We would really love to hear where you're joining us from. Please add any questions you may have to the Q&A box, however, not the chat, so that we can easily keep track of them. Today, we have a really fantastic panel to discuss this important issue. I'll give a very brief introduction to the speakers today. So our welcome is given by our director, Dr. Sylvie Briand, Director of Epidemic and Pandemic Preparedness and Prevention at WHO. Dr. Maria van Kerkhoff, the Emerging Diseases and Zoonosis Unit Head, WHO, will be setting the stage, introducing the quadripartite leadership in this area, and then moderating our panel and most of our Q&A. So our panel today, we have Dr. Jean-Philippe Doc, Deputy Director General at WOA, the World Organization for Animal Health, Mr. Wandi Kibret, from the United Nations Environment Programme, UNEP, Mr. Keith Sumption from the Food and Agriculture Organization, FAO, Dr. Amina Benihaya, scientist at WHO One Health Initiative, and Dr. Petra Kouri from the International Federation of Red Cross and Red Crescent Societies. So without further ado, I will give the floor to Dr. Sylvie Briand for our welcome. Over to you, Dr. Sylvie.
Thank you very much, Priya, and welcome everyone for joining this EPI-WIN webinar. And I see that we have already 416, 17, 18 participants today. So we are very pleased to see you all here today. For those who are new here, let me take a moment to introduce EPI-WIN webinars. EPI-WIN is a channel. We started this channel during COVID-19 pandemic as a platform to distill science and key information on COVID-19. But our vision is really to prepare for the next pandemic by providing timely scientific information on health emergency and also co-creating solutions through dialogue with all of you. So that's why your participation is so precious for us. So we have hosted a number of webinar series on EPI-WIN, tackling very different subjects and challenges and diseases. And we will continue, of course. And today we are launching a series of webinars on emerging zoonosis and the One Health approach. And I will explain you a little bit more what it means. And so we are very happy today because we are joined by One Health champions. And so we see that the EPI-WIN community is growing and adding people who have really something to say and to do in the field of emerging zoonosis with pandemic potential. So why are we choosing emerging zoonosis? First, because as you know, most of the epidemics and pandemics have an animal origin. And so, for instance, if you take avian flu, it's wild birds that have the flu, and then they transmit to backyard poultry, and then from backyard poultry to human. And so we want to really address those risks at the human, animal, and environmental interface and do it better so that we can prevent pandemic from occurring. So today, the objective of this webinar is really to bring to the scene all our partners who are working in this area. They are not all here today, but through the series, we hope we can have more and more people participating. And I would like to highlight that One Health approach is really about collaboration, about working together at the interface between human, animal, environmental sector, and to find ways to better implement interventions so that we can protect the health of the population, but also the health of other animal sector and environment, and at the end, the health of our planet. So many things have been done by the quadripartite, and the quadripartite is composed of FAO, WOHA, WHO, UNEP. So 4 agencies, UN agencies, who are working together to put in place intervention on One Health. And so I suppose Amina will describe it a little bit more, because she's the secretariat of quadripartite and the OLEP. But we are already working together. We have a joint action plan, and I hope that all the colleagues online will be able to give you a little bit more details on what does it mean One Health approach when it's applied to zoonotic emerging diseases. So, estimated colleagues and friends online, I look forward to listening to an engaging discussion on how each of our organizations are implementing the One Health approach for emerging disease prevention, preparedness, and response. And we are all convinced by the what. The One Health approach is critical to prevent, prepare for, and respond to emerging zoonotic diseases. But we want today to dive in the diversity of the how, the who, and the where the One Health approach is being implemented. And so I thank you all very much for joining this important conversation. We are looking for your question, your feedback, and I give the floor back to you, Priya. Thank you.
Thank you so much, Dr. Sylvie, for that welcome and introduction. So now I hand the floor to Dr. Maria to begin the overview of One Health and begin the panel as well. Thank you.
Thank you so much, Priya, and good morning, good afternoon, good evening, everyone. We're up to 559 participants so far, and I love seeing all of the, hi, my name is, and I'm from this part of the world. So thanks very much for joining us. So my name is Maria van Kerkhove. I work in the Department of Epidemic and Pandemic Prevention and Preparedness under Sylvie, and I lead our work on emerging diseases and zoonoses. And so you heard from Sylvie the importance of using a One Health approach to better understand these types of pathogens that cause epidemics and pandemics around the world. We're, in the midst of one right now, COVID-19, although we're in a much better situation, I should say, with emergency being lifted. The threat of these types of pathogens to cause an outbreak or an epidemic or a pandemic remains. And as Sylvie has pointed out, the collaborations that we have around the world at international levels, at local levels, are so vital in terms of our understanding of these diseases, why they spill over and spill between humans and animals, between animals, and the threat that they pose to animals, to our environment, and to people. So the quadripartite, we have excellent panel members today, and I'm going to moderate a Q&A over the next hour or so. And then I'm going to pass back to Priya to do some of the Q&A. But I want to welcome all of our panelists, and I'm going to start by asking you some questions. So I lead our work here in the organization at WHO on emerging diseases and zoonoses, and I'm also the COVID-19 technical lead. The last 3.5 years, the entire world has been focused on one particular pathogen because it has caused so much disruption. But the concept of One Health isn't new. Those of you who are on this call, who are on this panel, have been working using a One Health approach for decades. But to some, this might seem like a new concept. I have a question for each of you. I'm going to start, and I'm going to give you maybe 2-3 minutes to answer the questions so that we can kind of keep going through these questions. And my question, I will start with you, Keith, and panelists, maybe when you do take the floor, you could introduce yourself and say what your role is within your organization. But my first question is to you, Keith. What is one major way the COVID-19 pandemic has changed your organization's One Health approach for emerging zoonotic diseases and epidemic and pandemic preparedness and response? Keith.
Thank you. Yes, my name is Keith Sumption. I'm the Chief Veterinary Officer of FAO, also the leader for One Health in the organization. How has it changed? Well, in 2020, in the middle of, or the beginning of the most important phase of COVID-19, FAO was undergoing restructuring, and it took that opportunity really to recognize the importance of working in this area really across the whole organization. And so One Health has become one of our 20 priority programs, sort of elevating it from being mainly about zoonoses and antimicrobial resistance, which are vital and necessary, to something mainstreamed, as important, that many different division departments work on. Our organization covers from fisheries, forestry, for food and fuel, agriculture and food. So One Health connects all of those ones. Mainstreaming One Health means, for example, forestry department working on ecosystem restoration has to include in its work a consideration of what can happen in those forests in terms of public health, the forest to fork approach. So connecting really across the organization in this area. So we've really strengthened our work, working together, coming out of silos to work really across the divisions and at country level to try to be able to offer a better service that considers the risks, the zoonotic, environmental, ecosystem in terms of planning of national activities. Thank you.
Thank you, Keith. Thanks for highlighting the fact that One Health is much broader than emerging diseases and zoonoses. In fact, it covers so many different aspects that you mentioned: climate change, AMR, food, deforestation, and to the importance of working outside of silos. And I think that's one of the strengths of the quadripartite at international levels, but also at local levels. So thank you for mentioning that. So I'm going to move to Wandy. Wandy, same question. What is one major way in which the COVID-19 pandemic has changed your organization's One Health approach for emerging zoonotic diseases and epidemic and pandemic preparedness and response?
I'm Wandy from UN Environment. I'm the Policy Partnership Coordinator for the European region. I take maybe a couple of seconds before saying what we have integrated. I just want to go back a little bit, a few years. For almost 20 years, UNEP has been drawing attention to what we've been calling emerging issues of environmental concern. And then just 4 years before the pandemic, I think one of our Frontiers publication that was entirely devoted to alerting the world on zoonosis disease. So 4 years on, we went into this catastrophic phenomena that we all faced in. So what are we doing in terms of aligning or integrating the One Health into our work is, first and foremost, as part of the UN framework on the immediate socioeconomic response to COVID, one of the things we've done was that we developed this evidence-based assessment report on the risk of future zoonosis outbreaks called Preventing the Next Pandemic, Zoonotic Disease and How to Break the Chain of Transmission. And then following that also, it's our assembly, which is very important. How do we get the leadership in terms of ministers of environment and others? They actually adapted 2 specific resolutions, one on animal welfare, environment and sustainable development nexus, really looking into One Health approach. The second one is, of course, biodiversity and health, high on the agenda. Also, how do we ensure that One Health approach is also integrated into our biodiversity work? Most important of all, we are in the midst of triple crisis of climate, biodiversity, and pollution. And what we have done, our midterm strategy 2022-2025 has actually integrated a One Health approach into how we are going to deliver this work. Of course, not to mention, UNEP has just become the chair of the Quadripartite Alliance. We're very, very happy about that, hoping that we will continue to push the integration of the environmental dimension that is a little bit neglected into this work. Over to you, Maria.
Thanks so much. And we warmly welcome UNEP into what was the tripartite and now the quadripartite. And thanks also for highlighting the decades worth of work that's ongoing. I do think a lot of people think that this is a new phenomenon because of COVID-19, that the world needs to pay attention to diseases that spill over from animals. But in fact, there's a lot of work that's been going on for many years. And I think your word of integration for delivery is a really important one. We'll come back to that in a moment. I'm going to move to Jean-Philippe. Jean-Philippe, same question to you. A major way in which the COVID-19 pandemic has changed the way your organization deals with One Health and pandemic preparedness.
Okay. Thank you, Maria, and thank you for the invitation. I will switch in French as I call from Paris. Give 2 seconds to the interpreters. Merci pour votre invitation. Je suis très heureux de participer à ce webinaire avec vous aujourd'hui. Alors, la Covid-19 n'a pas vraiment été une surprise pour ceux qui travaillent dans le domaine Une Seule Santé, hein, en particulier dans le domaine de la santé animale, puisqu'on sait déjà que 70% des maladies émergentes humaines sont des zoonoses, c'est-à-dire des maladies qui trouvent leur source dans le monde animal. On pourrait citer Ebola, on pourrait citer d'autres maladies, mais ce n'est pas vraiment une surprise. Ce qui est une surprise, bien sûr, c'est l'évolution vers une pandémie et la nécessité de considérer l'approche d'une seule santé vraiment comme un fondement dans ce type de réponse. Et nous, quand on considère l'approche d'une seule santé, on a surtout en tête les aspects de gouvernance. Une des leçons qu'on peut tirer de cette crise, c'est que une bonne approche d'une seule santé démarre par une bonne gouvernance, et c'est la raison pour laquelle on a choisi, nous, à l'Organisation mondiale de la santé animale, d'assurer le leadership de ce qu'on appelle l'Action Track 1, du plan d'action global d'une seule santé, qui a trait à la gouvernance et au capacity building. Et une deuxième leçon, c'est que les aspects de renforcement des capacités sont extrêmement importants. Je voudrais citer un seul exemple. C'est le projet qu'on a sur le contrôle et la détection des fièvres hémorragiques, comme Ebo-Sursi, virus de Lassa et autres. C'est un projet qu'on a en Afrique centrale et qui aboutit à renforcer les capacités des laboratoires vétérinaires pour détecter le virus Ebola avec des techniques PCR. Eh bien, lorsque le virus de la Covid-19 est apparu, ces mêmes laboratoires ont été en capacité de détecter le virus sur des échantillons humains. Ce qui s'est passé, par contre, dans un certain nombre de pays, je ne les nommerai pas, c'est que pour des aspects administratifs, les laboratoires vétérinaires n'ont pas été autorisés à pratiquer les tests sur des échantillons humains. Et je pense que c'est une des leçons qu'on peut retenir de cet aspect, le décloisonnement des secteurs de la santé humaine, de la santé animale. L'approche d'une seule santé, c'est surtout une question de décloisonnement. Et nous, quand on parle de système de santé, on aime bien mettre un S à la fin pour indiquer que les gens qui travaillent dans l'environnement, tels que nos amis de l'UNEP, les gens qui travaillent dans le domaine de la santé animale, peuvent concourir au système de santé global. Voilà. C'est en tout cas quelque chose qu'on essaie de promouvoir dans les discussions sur le futur accord sur les pandémies qui est en train d'être discuté à l'OMS. Merci à vous.
Thank you, Jean-Philippe, and thanks for speaking in French and highlighting the fact that unfortunately, this pandemic was not a surprise. Those of us who work in this field know for decades we keep seeing these outbreaks that are happening. And my day job was before the pandemic began, was focusing on MERS coronavirus, and we were always talking about the threat that a coronavirus could pose at a global level. And unfortunately, we saw that with SARS-CoV-2. And I think you're right, there's a lot of opportunities to learn lessons, and I think many are. It's just how do we keep it up? So I'm going to move now to Amina, my colleague here at WHO. There are several of us that work on One Health aspects, and so I'm really pleased that you're joining the panel, Amina, and it's always a pleasure to work with you. So Amina, same question for you. One major way in which the COVID-19 pandemic has changed your organization's approach to One Health and for emerging zoonotic diseases and epidemic and pandemic preparedness and response.
Thanks, Maria. Hello, everyone. Nice to see that there are so many people connected. I'm Amina Ben Yahya. I work as a scientist in the One Health Initiative, mainly working on the coordination of the Quadripartite Secretariat and the Joint Plan of Action on One Health. I think it's difficult to be behind so many good panelists. The colleagues and you yourself, Maria and Sylvie, have already outline the importance and the impact that COVID had on the global recognition that we see today and the close linkages between human, animal, and the environment. I would like to start by quoting our DG. He always often says in his speech that human health does not exist in a vacuum and not can afford to protect and promote it. So it really emphasizes the close linkages between human, animals, and the environment. And Sylvie has already mentioned it. We are all advocating for this collaboration, this communication, this coordination between the relevant sectors. But I think it's important to remind all of us that One Health is not new to WHO. And there are already many technical areas that have been working on One Health for decades, including the several departments in the emergency, in trying to tackle emerging disease, but also trying to build the capacities in countries to prepare for public health at the interface. However, one of the really the breakthrough within WHO is really for us is from a coordination point of view angle. I think it's the establishment of the One Health initiative. OHI is a cross-cutting team which is mandated by Dr. Tedros to really coordinate both internally within WHO at different levels, headquarter, regional and regional level, but also externally with the partners, namely within the umbrella of the quadripartite, and to try to together with FAO with FAO, WOHA, and UNEP, really to advocate at global level for One Health. Additionally to this, the quadripartite has also established the advisory group called the One Health High Level Expert Panel, OLEP, and I'm sure that most of you are familiar with this group that is composed of 26 node experts that have the responsibility to strengthen the scientific evidence on One Health and also try to advise as much as possible the quadripartite long-term strategy on One Health. I would like to emphasize also that the One Health initiative was born under the context of COVID and under the context of health emergency setting. I would like to really say that we as a One Health initiative, we are not just limited to health emergency and zoonosis. We are working on a broader area such as linkages with the environment, the food safety, AMR, and also we've been trying really to position as much as possible One Health into the prevention perspective. This is also why strategically we are in the healthier population division, and because it's also relevant to other departments. Just in a nutshell, I think the major COVID pandemic has certainly changed the way WHO One Health approach, but not only for emergent zoonosis diseases and epidemic and pandemic preparedness, but response to all the threats that the human, animal, and the environment interface. Thank you, and over to you, Maria.
Thank you so much, Amina, and highlighting the complexity and the complementarity of so many different groups working with One Health. I think that's really key right here, because we show just in the 4 answers that we've had from the quadripartite, from FAO, UNEP, WOHA, and WHO, you can see the complementarity of the different organizations. And I think there's a very strong international commitment to this. We see it across all of our DGs, but we also see it at the technical level, and it's turning that rhetoric into accountability and turning it into action on the ground. So I think we're going to talk a little bit more about this as the EPI-WIN webinar goes on, but this goes beyond words. And so each of the organizations is really tackling this on, because we know the importance of this. Thank you very much. I'm going to move on to Petra. I'm going to ask you the same thing. So thank you for joining us. You're not part of the quadripartite, but you're part of the family. And we're very happy to have you on the line. Same question for you. Tell us one major way the pandemic's changed the way your organization deals with One Health or approaches One Health for emerging zoonotic diseases and epidemic and pandemic preparedness.
Thanks, Maria, and thanks, colleagues, for inviting us into this very important session and webinar and topic. I actually want to start with what Jean-Philippe mentioned, is that COVID was not a surprise for those that work in responding to outbreaks. And in fact, in December 2019, I'm going to take you back in time. There is an international conference that happens where all the Red Cross, Red Crescent societies come to Geneva, the 192 of them, ICRC, the governments of the 192, WHO attends as an observer. In that conference, December 2019, they passed a resolution, time to act and tackle epidemic and pandemics. The next day in the media coverage, the media covered it as a benign, useless resolution. Why they're talking about this topic? Because those that do not respond did not really appreciate. And then fast forward a few months, we're dealing with COVID. And so what did COVID do for us? It actually changed the narrative within the whole network. What was felt a few months back in the end of 2019 as not as an important topic to tackle and handle, suddenly now there's a political leadership endorsement around it. And there's more emphasis on centralizing the One Health approach. The programs that all of the Red Cross, Red Crescent societies were working on around One Health suddenly became a central topic and of interest and support within the network, the whole network, and then within the governments and the respective governments. The other thing that happened for us after COVID is now there's more, as I said, support to scale up this work, to reach out more and implement our programs in more and more locations. And then there's also now more appetite to bring this global, what they call the global resolution on time to act, to more of a country support, more on the ground, more of a whole of a society approach rather than in a siloed manner, but more of an integrated manner across the spectrum of actors around the table. Thank you.
Thank you, Petra. And thanks for highlighting the importance of the attention and the political support for this. I think we're in a tricky situation right now where we are with COVID-19. The world desperately wants to move on. But we've gone through this really traumatic event, not just in terms of the lives that have been lost, but the futures that have changed. And the political support that we have for epidemic and pandemic preparedness is strong, but it's waning because there are so many other complexities and so many other challenges, health challenges and non-health challenges that countries face. So keeping up the momentum for all of the work that our organizations do in this space is really quite critical. So thanks for mentioning that. And that's something as organizations, we kind of have to keep up that advocacy and that attention so that governments have the support to continue to work across the different systems and sectors. So thanks very much. Now I'm going to go back to you, Keith, and ask you specifically a question. So FAO has been a member of the tripartite for the last decade. Could you give us an example of how One Health is being applied in tackling a zoonotic disease related to issues of livestock and agriculture?
Thank you very much. Well, I could speak on avian influenza, but I think my colleague Jean-Philippe will probably give that example and talk on that one later. So I want to sort of give the example of Rift Valley fever. Rift Valley fever is an explosive viral disease of livestock causing abortions and very high mortality when it occurs, but it occurs very sporadically. And it occurs usually as a result of abnormal rainfall patterns in an area. So there's a number of environmental determinants that come behind it. Because it's so explosive in livestock, there's very little time to react. You have to be prepared for that. Now, the reason it's important is that it's a viral hemorrhagic fever with significant human health implications for those who are exposed to infected livestock. And that can be quite a number of categories of people. So what are we trying to do? Well, firstly, using the environmental indicators from satellite imagery and weather predictions to be able to give a forecast ahead of time to those countries which are at risk. But that forecast isn't going to be very helpful unless there's an ability and capacity to be able to respond to that. So countries need to have their own risk assessments done together between human and animal health to consider what do we do under these circumstances, what extra surveillance might be needed, what extra alerts or communications might be needed. Early detection of the first cases in humans or in animals is important to be able to then provide a response. And the response might be mass animal vaccination, or it may be the communication side. There are a number of things that we can do. Better preparedness. What does it mean? Well, it means being able to have a plan for that event that is tested and feasible in that situation. How do we prevent? Well, that can be through communication and behavioral changes in relation to those livestock owners who may come across aborted fetuses or at abattoirs. So prevention it matters. Better response. We have done those together at times. We've had joint missions together to help, but essentially response is a national capacity to be able to work together in those situations. How do we look at it afterwards? Well, now we're talking about the 717, the paradigm of are we able to respond effectively? Well, we can look back and say, was it first detected in the human health population or was it in animal health first? We hope that through our work strengthening national veterinary systems, we will be able to have more detection on the animal side before the first human cases. And that brings me to my last point, working on connecting animal health systems and human health systems at country level so that epidemiologists in a suspicion or in a high-risk situation can ask what's happening in animals. Are there hemorrhagic fevers in the same areas in people? And that way, hopefully get to prevent more than respond in future. Thank you.
Thank you, Keith, for that very comprehensive answer covering so many different important aspects of this. I have a follow-up question for you. How is climate change and the changes in climate and rainfall as one of the environmental predictors, how is that challenging the ability to do what you've just outlined in terms of whether you want to call it prediction or prevention or preparedness and getting ready for some of these areas because these are sporadic events that are happening? How is that complicating the work that you've just described?
Yeah, thank you. Thank you for that. Well, I suppose it challenges what we think is a normal pattern of events. So, for example, with the one I gave you, Rift Valley fever, we have been surprised at times when flooding does not result in an epidemic of Rift Valley fever, but then we get cases in another area which are not normally in the past ones that we would consider would be natural for Rift Valley fever. So we're having to ask the question, is that climate change or is that changing epidemiology in that situation? Undoubtedly, vectors are moving and that brings a more northern or southern extension of things which can be important. We're seeing vectors move between continents and that will also, some of that may be climate change, but undoubtedly the impacts of invasive species, whether they are invasive vectors, invasive viruses, or animals in some circumstances, is certainly challenging disease management, risk management in multiple areas.
Thanks for that. It's certainly dynamic, in terms of what is happening, whether it's a change in the epidemiology or climate, as you mentioned. We're also quite worried about the movement or the changing geographic range of some of these vectors. If you think of arboviruses, we've seen some countries that have never experienced dengue or chikungunya, going further north or further south. And so it's quite dynamic. So the agility of countries to be able to manage this is quite important. So thank you very much for those answers. I have to say, I love being on the end of asking the questions and not having to answer the questions. So I can completely get used to this. Wandi, I'm moving over to you next. So UNEP recently joined the tripartite, now forged into the quadripartite. What are the challenges for integrating the environmental aspects of One Health? You touched upon this in your earlier answer, but if you could expand upon that. What needs to be done to further consider the environmental drivers of zoonotic disease emergence?
Well, in general, at the country level, the environment sector has traditionally been reserved to get involved in the One Health space. Sometimes it's a question of mandates, not the case in the when it comes to the Quadripartite Alliance, as UNEP has been eager to jump into the space despite, of course, the limited capacity resources compared to the other partners. We thought it would be a challenge to bring in other dimensions beyond zoonotic disease and AMR, such as pollution and climate. But we see receptiveness on the part of our partners and OLEP. And of course, a perfect example, just yesterday, you ended WHA 76, and what a fantastic thing to see resolution on impact of chemicals, waste, and pollution on human health that it actually embeds the One Health approach. Are great signs that things are moving in the right direction for integration of environment dimension into One Health. Zoonotic disease remains an important aspect, of course, and OLEP is looking deeply into the drivers while we wait for evidence and further research questions to emerge from that work. We can say with confidence that good conservation and ecosystem management practices are likely to reduce the disease of zoonotic spillover from wildlife to livestock and people. So preventing and reducing habitat destruction and fragmentation, sustainable food production, and striving to ensure that the trade in certain species of wild animals is sustainable, legal, safe, and that way they're likely to contribute to risk reduction. Over to you.
Thanks, Wendy. You mentioned a lot of really important keywords here. And Keith, all of you mentioned prevention. Prevention doesn't get as much attention as response. And this is the cycle of panic and neglect that we live in. We went through cycles of panic neglect in the middle of the pandemic over the last 3.5 years, but prevention is a harder sell, if you will, despite the fact that we can talk about the safety of the animals, food security, public health aspects, livelihoods, etc. What do you think? I have a follow-up for you. I'm going to give you all follow-up questions because I'm loving this role that I'm in right now. What do you said we're moving in the right direction. What do you think? How could we speed this up? What is it that every one of you online has an enthusiasm for this, obviously, because you're in this field and you've been in this field for such a long time. How do we move it forward even faster? Wanda, over to you.
I think a good example is, what's going on right now with the INB, the conversation, although you're looking at 3 different pillars on prevention, preparedness, and response. I think there's also an appetite in terms of looking at what are the root causes, what are the drivers really causing this kind of pandemics at the moment. So, prevention is kind of the neglected child, but it is getting some attraction in terms of attention and, looking at what came out of the CBD, the Convention on Biodiversity, that really talked about the integration of One Health into the development of future national biodiversity action plans and strategies. I think these are the right steps in terms of let's focus on where is the root cause, where is this coming from? If we invest a little bit, balance it between the prevention, preparedness, and response, I think we can actually, using the same word, we can actually prevent the next pandemic too, if we invest more on prevention. Over to you.
Thanks, Wendy. I certainly hope so. I think you're right. Root causes, looking at incentives, disincentives. Let's keep it up. Okay, so Jean-Philippe, my next question is for you. As part of the 90th General Session, WOHA hosted the Animal Health Forum focused on avian influenza. How is WOHA approaching future emerging disease risks, such as avian influenza, which is receiving quite some attention these days? Over to you.
Very good question. I will stay in French to respond. Alors, c'est vrai qu'on a eu notre 90e session générale la semaine dernière, dont le thème central était la grippe aviaire. Et comme l'a rappelé la représentante de la Croix-Rouge, Dr Petra Khoury, c'est très important de démarrer la discussion au niveau politique. Donc, ce qu'on a fait, nous, lors de notre session, c'est qu'on a organisé un panel à haut niveau avec plusieurs ministres, des représentants à haut niveau. On avait la directrice générale adjointe de la FAO, on avait le ministre français, le ministre de pays en développement, pour qui accentuer cette prise de conscience que on faisait face peut-être à un phénomène de maladie émergente. Ensuite, on a organisé un panel, un forum pour tous nos membres, de façon à partager la connaissance scientifique. Donc, avec l'aide de nos centres collaborateurs, l'aide de plateformes comme Oflou, on a souhaité actualiser les connaissances scientifiques dans ce domaine. Et c'est vrai que la circulation de cette souche, en particulier H5N1, pose un certain nombre de questions. Comment passe-t-elle des oiseaux sauvages, notamment les oiseaux qui ont un écosystème près des côtes, près de la mer, sur certains mammifères aquatiques, quel est le risque de passage sur l'homme, quels sont les phénomènes d'amplification à travers la faune sauvage, à travers les flux commerciaux. Donc tout ça a été pris en considération. Et une des leçons d'ailleurs qu'on tire de toutes ces maladies émergentes, c'est qu'il faut vraiment s'appuyer sur la science, les dernières connaissances scientifiques. Certains de mes collègues ont cité le panel à haut niveau Une seule santé, OLEP, qui est en train de produire des données intéressantes sur les notions de prévention que vous venez d'évoquer, Maria, les drivers, l'early detection. Donc, la science est vraiment ce sur quoi il faut s'appuyer dans ce genre de phénomène. Et puis, tout finit toujours par ce que souhaitent nos membres. Qu'est-ce qu'ils attendent de nous en tant qu'organisation internationale? Et ça, on a pu le préciser à travers l'adoption d'une résolution par l'Assemblée. Le collègue de l'UNEP a mentionné certaines résolutions. Et c'est vrai que en tant qu'organisation internationale, on peut donner une impulsion à travers une résolution de nos membres. Alors, la difficulté d'une résolution, c'est qu'il faut trouver le consensus, mais on a pu trouver un certain consensus sur, par exemple, la nécessité de notifier, de surveiller les souches qui circulent, assurer la transparence au niveau international. C'est très important. On a des systèmes d'information sanitaire qu'il faut connecter entre eux pour mieux analyser ces phénomènes. Il faut assurer le contrôle des maladies en incluant tous les outils disponibles. Ce qui veut dire, dans le domaine de la santé animale et de la grippe aviaire, ne pas s'interdire la vaccination pour peu qu'on puisse s'appuyer sur des souches vaccinales qui correspondent vraiment aux souches qui circulent. Et c'est l'un des objectifs d'OFLU, d'ailleurs, d'assurer cette concordance. Qu'on puisse, par exemple, utiliser les dernières technologies pour distinguer la présence d'anticorps vaccinaux avec la présence d'anticorps induits par l'infection naturelle, les fameuses technologies DIVA. Il faut aussi considérer que la vaccination n'est pas une protection absolue. Elle aide à diminuer la charge virale, mais elle doit être complétée par d'importantes mesures de contrôle que sont, par exemple, les mesures de biosécurité. Par contre, il y a un certain consensus aujourd'hui pour dire que éliminer systématiquement les troupeaux d'animaux infectés, on a éliminé à peu près 500 millions de volailles au cours des dernières années, entre 2005 et 2022. Bon, à l'heure où on parle de gaspillage alimentaire, c'est peut-être quelque chose qu'on peut éviter grâce à d'autres mesures comme la biosécurité ou la vaccination. Un point très important, c'est que nos membres ont réitéré la nécessité d'appliquer les standards, que ce soit les standards de l'Organisation mondiale de la santé animale, mais ça peut être aussi le règlement sanitaire international. L'occasion pour moi de rappeler qu'on a des activités en commun avec l'OMS pour s'assurer que les pays appliquent de façon stricte les standards de santé animale et les standards de santé humaine à travers ce qu'on appelle des Joint External Evaluation que l'on conduit ensemble. Et dernier point, et ça c'est vraiment une grande satisfaction pour nous et pour moi en particulier en tant que membre de la quadripartite, c'est que les pays ont réitéré l'importance de la coopération internationale. Les pays tout seuls ne peuvent pas endiguer de telles maladies qui sont véhiculées par la faune sauvage, par les couloirs migratoires. Il faut vraiment assurer une coopération internationale. Donc la quadripartite a été bien sûr mentionnée dans cette résolution adoptée par notre Assemblée. Donc ça, c'est un signal fort d'importance de cette quadripartite, incluant la balance environnement, depuis l'inclusion de l'UNEP, la nécessité de réfléchir à des stratégies. On a notamment une plateforme commune avec la FAO qui s'appelle le GFTATS, qui veut dire Global Framework for the Progressive Control of Animal Diseases, à travers laquelle on réfléchit à une actualisation de la stratégie en matière de santé animale pour le contrôle de la grippe aviaire. Donc, une grande leçon tirée de cette Assemblée générale, c'est la nécessité d'intensifier la coopération internationale, ce qui permet d'aller vers la prévention que vous évoquiez, Maria. Et je note d'ailleurs que le représentant de l'OMS, Francisco Branca, qui est intervenu à l'occasion des questions au panel à haut niveau, a fait le lien avec les discussions en cours sur le traité, l'accord sur les pandémies, en souhaitant que les discussions aboutissent à mettre en lumière la nécessité de prévention pour mieux prévenir ces maladies que sont les grippes aviaires. Merci.
Thank you so much, Jean-Philippe. A lot of really important aspects just now. I think couple things to highlight, and you can choose which answer you want of my follow-up questions that I have for you. Thank you for pointing out the point around a suggestion that you could just get rid of the poultry, or that has consequences. It's not as simple as something like that. I worked in Cambodia for a while, and so I'm heavily influenced by my time there. And the result for avian influenza was to cull the poultry, but where was the compensation? For farmers who relied on the sale or the protein of those animals. But maybe you can highlight that and how your organization is working on that. And the other follow-up is related to your words of cooperation and transparency. So we live in an interconnected world, and these pathogens, these animals don't respect borders. So whether we like it or not, whatever could be identified somewhere could be somewhere else in the world within 24, 48 hours. And given the way that birds fly and animals are traded, it's possible that we could see the spread of these diseases before we even know it. In terms of cooperation and transparency, you have a reporting system with OIE. You have reportable diseases, just like WHO does with IHR. Is there anything that you discussed, within your general session related to those aspects of trying to ensure that we do have international cooperation and transparency when it comes to emerging diseases affecting animals?
Yes, thank you, Maria. The transparency topic was the first to be highlighted in the resolution, saying that members, the Assembly recommends that members maintain transparency through timely and comprehensive reporting of avian influenza events, as it is described in our terrestrial animal health code. Members should promptly share samples and virus isolates, virus sequence data, and associated epidemiological information with reference laboratories, a food platform, and so on. So this is really the first thing which was highlighted by the Assembly. Coming back to your first comment on the culling strategy and the need to compensate these losses for the farmers, I totally agree. This is a key challenge. Of course, it's easier in developed countries, which can benefit from funds, national, European, if you are talking of Europe, but more difficult in developing countries like Cambodia, and we need to support all the initiatives to develop these funds. Perhaps tomorrow the pandemic fund could consider some projects regarding this, but really it's instrumental. We saw it in Europe with the eradication of BSE for example, the bovine spongiform encephalopathy. We saw that also youth vaccination campaigns helped to eradicate animal diseases like rinderpest, which is the first animal disease to be eradicated from Earth. So we have to recognize that at some time the challenge is the means and is the money. And with that, I come back to my first point, the need to involve the political level to have sustainable support to prevent and eradicate diseases. Over to you.
Absolutely. Thank you very much for those follow-up answers. I do want to highlight that there's a lot of really good comments that are coming in the chat as well. It's hard to monitor those as we're speaking there, but please do, those of you who are online, we're up to 687 participants, do look there. And we have a Q&A that's at the bottom. We're going to try to filter some of the questions so that we could give more questions to the panelists as we move forward. Jean-Philippe, thank you very much. Amina, next question is for you. So the chairmanship of the quadripartite has just been handed over from WHO to UNEP. What are your main takeaways from the last year? And what do you see as the main opportunities or challenges for advancing the One Health Joint Plan of Action, action tracks that relate to zoonotic diseases? And for those who might not know, maybe you can say a little bit about what it was to host the quadripartite in terms of being the secretary, and also maybe a little bit about the One Health Plan of Action. Over to you.
Thank you, Maria. I would like first to start by saying that WHO was really honored to be the first chair of the quadripartite, with UNEP joining the former tripartite. So it's been a busy week, but we think that it was successful with key deliverables. And WHO has, together with the partners from the beginning, we have set a vision paper when we took the chairmanship, and this really allowed us and helped us to align our approach and vision and be sure that we can effectively deliver and have a smooth coordination amongst the quadripartite. So specifically, WHO had set 5 strategic priorities during the chairmanship. The first one, of course, is about the One Health Joint Plan of Action. That is really a framework for working together as a quadripartite in order to detect, prevent all threats at the interface. And we have been quite busy in finalizing the launch, but also preparing for the rollout and the implementation at country level. The second is all the work around OLEP and all the key deliverables that OLEP has achieved to advise the quadripartite. And the third one is really to try as much as possible to communicate at global level and have this outreach community to advocate for One Health and for the Joint Plan of Action. Strengthening our coordination, especially with the joining of UNEP, was one of our key activities at global level, but also at regional level, where we have established some help the regions to establish coordination mechanisms that also speak to the to headquarters and to the global initiatives. We have also discussed how to align all the global initiative, including the Joint Plan of Action, to the regional context. And least but not last is really making sure that One Health is reflected in the global instrument. I think the main takeaway from last year, at least for me, is that We talk about One Health. Now One Health is in every single mouth, but I think that it still needs to be further simplified and communicated. From our interaction with the member state, with the regions, I think it's we need to make it more practical so that it's being understood by countries. Some countries are really concerned that intersectoral collaboration will be a burden rather than a solution for them. So it tells us that we need to further communicate on this. From the discussion, we thought it's important to show that there are many successful stories that we can show, and some case studies that are available that can, be of how do you say, examples of best practices to show that One Health is not, it's a way of working that is really and not a burden. So I think it will, if we talk also about the opportunities to advance the work of zoonotic disease, here we have many. An example is the momentum at the highest global level, but our engagement with the G20, especially with G20 Indonesia and India, it was really clear that zoonosis is one of the priorities. If you talk to them when it comes to One Health in implementation. So we could feel that there is really this political willingness from the countries that amongst many other technical areas, they see zoonotic diseases control as really an important agenda for them. At regional level also, we saw this momentum with a strong political commitment from recently, just on the 10th of May, there was the Asian countries that adopted an Asian Leaders Declaration on One Health, and in which there is reference to the joint plan of action. And what the declaration says, moreover, is that it has some concrete deliverables, such as the development of an Asian One Health joint plan of action, a situation analysis to see where the countries in this region are at when it comes to the implementation of One Health. So we see that there is a momentum at global level, but also at regional level. Regarding the challenges, and based on the discussion we had with different partners and countries, the key challenge also is then when countries approach zoonosis, they still have this key focus on preparedness and response. You mentioned it before, prevention is still not fully incorporated in the One Health approach. And I think that there is we see that prevention perspective is still missing. And we as quality partner, we need to further work on this. What we see also that we see a disproportionate focus on detection and response. And this really suggests that the number of factors, such as the most of the time it's insufficient evidence, complex mechanism, and lack of political willingness really to invest in prevention. So I think that for us it was we have a progress report that I can share the link just to for the participant to look on what were the key achievements during the WHO chairmanship. And also, last but not least, I think that another challenge is how to secure sustainable, adequate allocation of resources, and not only funding. It includes funding, but it's also personal infrastructure that should be in place across the multiple sector. And securing this sustainable funding and resource commitment can be a challenge, especially when we talk to countries where they have so many other competing priorities and funding mechanisms vary among the different sectors. So these, in a summary, short summary, what was the main take-home messages during the WHO chairmanship? Over to you, Maria.
Thanks so much, Amina, and thanks for taking on that chairmanship and passing the torch so well. I think a couple highlights for me of what you just said there. One is around communicating that using this One Health approach and in this joint plan of action is an enabler and not a burden. And I think you're right. I think it is how it is phrased and how it is used and can be supportive for country and subnational action. And your points about momentum. We are at a critical point right now, and we need to keep up this momentum at global, at regional, at national levels to be able to carry through all of these lessons that we keep learning after each outbreak, after each pandemic, and the investment, not just financial, but in the workforce. and across the different sectors, not just the human health side of things, but also the veterinary side of things, on the environmental side. I know from where I sit, we always have, well, we don't always have enough people working on the human health side, but we have far less working on in the veterinary sector and in the environmental side as well. And part of that investment is really, really important. So, I mean, I thank you very much. I'm going to go to Petra. Thanks again for joining us in this panel. So how is IFRC leveraging its networks of volunteers and societies to champion the One Health approach? What are the challenges in using the One Health approach for pandemic preparedness and response in countries, and in particular with communities? Because we all know, and we keep saying, communities begin and end in communities, but we should also say that communities can prevent these outbreaks from happening in the first place if they're well equipped, informed, enabled. So over to you.
Thanks, Maria. I think you meant pandemic starts and end in communities.
What did I say?
Communities start in communities and end in communities.
Sorry. Well, thank you for the correction.
But this is the sentence, the famous sentence that we've been repeating for the last 3 years over and over, just to emphasize the importance of community actors and bringing them in within the whole of the society and approach to responding to pandemics. I think one sentence that Amina mentioned is One Health is a way of working. I like that because this is the way of working when it comes to the Red Cross and Red Crescent societies on the One Health. And I do have a less than a 1 minute clip to share. How do we work on the One Health concept? I believe that sometimes an image is 1,000 words and a video is more than 1,000 words. So I'll pass it and then we'll come back to your specific questions, Maria.
Okay, let's play the video.
Ng'ombe ikikufa, watu wanapenda sana ng'ombe yao kwa sababu walikula tangu wasaliwe na nyanya yao na baba zao wanakula. Sasa wanapenda kwa sababu, wacha niseme, walipita damu zao. Mimi nafanya hivi. Mimi nikiwa Joshua. Kwanza mimi naachana kwanza na isomo. Naachana kwanza na hiyo mila ya kuwa ninapenda ng'ombe kuliko maishani mwangu. Na kitu ambayo sisi tunataka tukiwa volunteer, tunataka watu wetu watusikilize na watuelewe, kwa sababu sisi tunataka twende mbele na tunataka waachane na hizi magonjwa. Wanatujua sisi tumesaliwa hapa na tunataka kubadilisha, kwa sababu ni hao ndio walitusoma tukawa mahali tuko sahihi.
Wonderful. Back to you, Petra. I think you're muted. There you go.
Yeah, that's better. So to go back to your point on volunteers, the network has 17 million volunteers, and we leverage that 17 million when it comes to community health. And specifically on the One Health approach, our work within these, across these 17 million volunteers has been to empower them with the tools to be able to prepare their communities for early detection. And specifically on the epidemic intelligence, whether it is community-based surveillance or it is risk and hazard mapping. So that's the kind of tools we provide them. We also empower them with epidemic control measures so that they can respond better and apply control measures within the communities. The strength of this volunteer base is not just its reach and figures, but also its presence. They're within the communities before, during, and after pandemics. They're a trusted voice, as you can see from the video. They listen, they engage, and they bring on board. They take away the anxiety factor, the fear factor. Maria, you mentioned the questions about who compensates, and in these communities, these questions are very key. And that's where engagement and listening and hearing them. There's also cultural sensitivities in many of these situations. Their livestock are part of their family. They're not just a source of economical source, but in many of these communities, their family members. That's how precious they are to them. I think one of the strength is the data, and I'll just share a little bit on the data part. How has this One Health approach within COVID supported? So during COVID, just a little bit of figures, 57 Red Cross, Red Crescent societies globally conducted community-based surveillance. That's how powerful they were able to support their communities. They were able to support 9.1 million people that were isolated because they're contacts. So that's also part of community engagement and their support to their communities. Outside COVID, there's a lot of work that has been done on measles, polio, meningitis, rabies, anthrax, Rift Valley fever, you name it. They're always doing this type of work. In many locations, they were the first ones to detect the first case of COVID. So for example, in Somaliland, they detected the first case of COVID within the country. I'll go to the question on challenges because that's usually the part that we want all of us together to come together and try to work on resolving these challenges. I'll start with the internal challenge. Within our own network, we have some silos approach. And that's part of it is related to the human versus the environmental programming and how programs are built. And that's because many of this is also driven by donors and by the donor community. So that breaking also these siloed approach across programs, whether it's human versus environmental. We talk a little bit about climate change, also the programming of climate change and how to loop in all of the other and do integration across the board is a challenge for us. The other challenge is at community level, there is not enough of animal actors. And what I mean here is that when our health community actors identify animal health alerts, these alerts go to a dead end because there's not enough counterparts within communities, within countries to carry over these alerts and build off on them. So that's a challenge, the continuation, closing the loop and making use of the early detection, early information that is produced by the community-based workers that we have. Another challenge is sometimes there are lack of vaccines. One example I'll give, in one country we had, in Guinea, we had a dog vaccination campaign, and then suddenly there was lack of vaccines. So while we rallied the community, we launched the vaccination campaigns, we were challenged with suddenly lack of vaccines. So that's also a challenge about the supply chain. We saw part of it in COVID, but it also happens outside COVID, and it has been happening in the past. Another challenge is there's a need to create a One Health platform. I see there's a quadripartite here approach, which is highly needed. And I think maybe moving this at a country level also is key on advancing the agenda, creating this One Health platform for integrating the community health component into it, just because of what I mentioned earlier, the continuation of the alerts and the flow of information. Finally, the last challenge I put forth is we speak about epidemic, pandemic, a whole of a society approach. I think also on this One Health, producing this One Health programs approach, we should also keep in mind this whole of a society approach and bringing all the actors to the table to be able to build a comprehensive response and prevention. Thank you.
Thank you so much, Petra. Completely agree. Again, in my time in the Mekong, the importance of village animal health workers, and Jean-Pierre, I see you put something in the chat as well. The community animal health workers, absolutely critical role You talk about, Petra, and all of you have talked about really the power of people, that can carry out all of this way of working, as you put it, Amina, and trusted voices, people who live and work in communities and care for these animals, many of whom are treated like family members. It is quite important from the ground up, not from the top down. I mean, we have incredible representation from the organizations here, but everybody who's here has spent time in the field and has spent time in country working with people and communities. And I'll correct myself. What I tried to say was that, outbreaks can begin and end in communities, but it's the communities themselves, if they are enabled, if they have access, if they have information, if they are empowered, can actually prevent some of this from happening. And I think that's why we're here. And that's why we work in this field. I'm going to ask one more question to all of the panel members, and then I unfortunately have to leave, and I'm going to pass the moderator back to Priya. But the one question I want to ask, there's lots of really fantastic questions coming in the Q&A, and I'm sorry we're not going to be able to get to all of them. I do want to address one. There's some questions about why don't we have, certain organizations represented here today. As Sylvie mentioned, and as Priya mentioned, this is part of a series of webinars that we want to have. If you have some good ideas, those of you who are on and you want us to cover in some upcoming EPI-WIN seminars, please reach out to us and reach out to the team with your suggestions. We would be more than happy to take those. So I'm going to ask one question. And this is from one of the viewers, and I'm sorry I don't have the name. One Health approach, it is critical, but trade rules, production, including industrial agriculture and global supply chain dynamics, have huge impact on zoonotic transmission and the climate crisis. Could the tripartite, and I'll say quadripartite, take an all of society policy pathway of structural One Health that curtails the damaging roles of corporations on human and planetary health? Who would like to tackle that question? Maybe I'll look at Keith. Maybe you could start.
Well, thank you for what is really quite a difficult question to try to answer. I think it's very clear that animals matter. Animals matter for multiple reasons, from the community level up to national agricultural policy. And animals are usually owned by private individuals. So we're here dealing with the public-private matters. Private goods, livestock, for example, public goods in terms of the impacts of those livestock on human health as well as the wider society. So these sorts of discussions that you've said and you've talked about do very much come into those discussions that were mentioned by Jean-Philippe where the rules relating to international trade are debated and discussed. But in an imperfect world in which rules may be developed by consensus and will have to be developed by consensus, there will be some risks. And part of our work is identifying those risks. And ensuring that at country level, in particular, they look at a range of risks together rather than in a joint risk assessment approach So I think that approach is the start of a all of society approach, since the consequences down the line can be so serious. So I'm not sure that we can do it as a quadripartite, but we don't have necessarily the way that we can convene all those parties in one body to look at that, to be able to decide on what would be the consensus all of society approach. It's very much supporting countries to do that work for themselves, to work through those issues. Thank you.
Thanks, Keith. Jean-Philippe?
Yes, I would like to elaborate on Keith's response and remind that WOHA was created in 1924 with a trade concern. In fact, at this time, the funding members wanted to set up an international organization to address the risk of international trade of animals and to block the expansion of animal diseases related to this international trade. So this is an important objective. the security, the safety of international trade. It works for animals, but it could be implemented also for other sectors. And I want to quote part of the resolution recently adopted by our members during the 19th General Assembly. The Assembly recommends that members respect and implement the adopted WOA standards and recognize compliant use of vaccination without negative consequences on trade. But they had, when the vaccination program is supported by vaccination monitoring and disease surveillance systems that can demonstrate the effectiveness of vaccination and absence of infection. That means that the principle of science-based standards, the principle of monitoring, the principle of efficiency and control of the measures are also reminded in this resolution. Of course, trade is important. It's very important for the incomes of some farmers. But the security, the safety of trade is also very important to avoid the dissemination of emerging diseases. Over to you.
So I think Maria has signed off. So if anybody else would like to follow up on the question, please do go ahead. Okay, in that case, I'll move on to another question. We had a number around information systems. So this is for everybody, and please jump in when I've finished. So information
actually,
systems. Oh, yeah.
I can take this. Oh,
no, just quickly on the previous question. I know it is a very loaded one in terms of trade, but one thing we can say, our unsustainable patterns of production, consumption, and behavior is responsible for many of the crises that we are seeing today, whether we're talking about the triple crisis of climate change, biodiversity loss, or pollution. It is all about unsustainable patterns of consumption, production, and behavior. At the same time, in terms of, we have this convention, CITES, so the Convention on International Trade in Endangered Species, something that needs to be fully implemented. I think we have the tools available in terms of ensuring these things never happen. And then finally, one of the things in terms of the behavior side is, look, COVID is a perfect example. It is our behavior that actually brought it. It is our behavior that spread it. And at the same time, it is our behavior that can stop it. So I think that this unsustainable angle of production, consumption, behavior is so fundamental in moving forward. Over to you.
Thank you so much, Wendy. That's a really critical point that I think all of us, whether we engaged in One Health professionally or not, can really think about this in relation to our own lives and our own consumption. So appreciate that intervention. So yeah, just moving on now to the next group of questions around information systems. So we've had questions, can we collectively create an information architecture for One Health? Perhaps one is already cooking and in the mix. And as a health information systems expert, I'm interested in what data we should be collectively collecting and sharing between sectors to improve our responses. So again, whoever wants to jump in first, please go ahead.
Maybe I can start. Priya?
Please do.
Yeah,
please do.
I think, yeah, agree that we need some of the most important gap is we see at global level regarding surveillance and how to really have this integrated surveillance system in place, which would have implication regarding the access data from different sectors. And we know how it's difficult to share the data between the different sectors, how to better link these data and guide the One Health decision. So related to this, I just wanted to mention that OLEP is also looking at how to define One Health surveillance. What do we know about the presence of potential zoonotic pathogens? And this really include the current hotspot identification. And the identification of existing in international guidance and novel approaches for integrated surveillance, and also the level of implementation. So they are also looking at how the identification of existing agreement and system. We know how it's difficult to allow and to facilitate the sharing of surveillance data, as I said, between different sectors, how to identify and define a One Health inter-laboratory system to share the different technologies and samples data, how to that would allow us to provide this early detection. So we need more specificity as to what different sectors need to do. For example, we always, because we are in this system thinking, we always like to give the example of food systems, that how to make them more sustainable would be a critical component of One Health. But the biggest challenge is that we need to provide the evidence of effective action and really to make the decision with a major economic impact. So I will share some of the work that OLEP is doing, but these are my first thought on having a global surveillance system. Over to you, Priya.
Lovely, thank you so much, Amina. That was super helpful, and I've seen some comments as well talking about having the right data and sharing it in the right way as well. If any of the other panel want to speak to this point about information, possibly also research gaps or data.
Yes.
Yeah.
Thank you, Priya. Thanks for the question as well. So I draw attention to a couple of things. One is that the United Kingdom, as part of its G7 timetable, did support the quadripartite to look at their information systems and what we could do in a new way to be able to better leverage those sources we each have access to in the 4 organizations. So that scoping study was done. One of the things it came up with was the realization that there can't just be one purpose to this. There has to be multiple purposes to having this shared information, considering that we have also significant risks to things like the environment coming from animal disease or even from human activities as well. So there's the information system should be built that it has multiple uses, including the early detection for potential pandemics. The other thing to say is that together we're also involved in looking at how to connect animal health information systems with public health information systems, and recently had a workshop on that to try to start building the tools that will better connect for the countries that want to do it, their information systems, so they work at country level. This is not quadripartite so much as animal and human health systems. Thank you.
Okay, wonderful. Thank you, Keith. And I can see Letitia has added the link to the scoping study that you mentioned in the chat, if anybody is interested. So just opening to the other panelists, if they also want to come back on this point about information, data sharing, research. Give you a second.
If I may, Priya?
Yes, please, go ahead, Dr. Doc. Thank you.
Yes, of course, sharing data is a key principle. It should be a One Health principle. So I think that everyone would agree on the principle. But I want also to highlight that to move forward and to go to move above principles, we should also consider practical arrangements, such as the technology we want to use, the rules we want to use, the harmonization of this data between animal health, human health. So above the principle, it is not a small topic. We have a lot of work home to do regarding the exchange of data. I guess that the pandemic and intelligence hub created by WHO in Berlin will also be instrumental to together all the one which produce and can exchange data. Of course, as WOHA will remain totally available to share data. This is also an asset. When we mention avian influenza, I mentioned this platform OFLU that we have together and which help to anticipate which strains of flu should be considered for human vaccines. So it starts with sharing data and it ends in a vaccine to protect human beings. Over to you.
Yeah, thank you, Dr. Dopp. Great point that we should be kind of goal orientated in why we're sharing data and for specific ends in mind as well. I'm conscious that we're drawing to the end of our time, so I will finish with one question, and apologies again, we've had so many, which is fantastic engagement, but we will be using these questions to prepare for future webinars. We'll also be sharing them with everybody in the panel today, so your inputs will definitely not go unheard. But the final question actually is one that Keith marked as something he would like to answer, but then we can open it up to everybody else. And we've had a few questions around silos within organizations and also, I guess, externally. But basically, how does the composition, this question asks, so WHO, primarily physicians, WOHA, this questioner asks primarily veterinarians, but FAO is unique in that vets are one division working in-house across sectors. How does this affect each organization's approach to One Health? And happy if the panel also want to interrogate the question as well. So we'll start with Keith because you did mark that as one you would like to answer, and then we can open it up to everybody else.
Yes, I think it's a very interesting question. I think what's changed over the last, let's say, three years, I think driven in part by the COVID situation, but also I think by more wide considerations, is that we really have very strong engagement with those who work on complex multi-sectoral problems, because that's how most of our problems really are. So governance issues and lawyers within the House now getting, really contributing very strongly, because so much is to do with, the international regulations, as well as what makes for real change in terms of national legislation, for example. So that's an example of a change. It's no longer veterinarians with their technical knowledge. It has to involve many, many broader categories who can deal with and help us with these complex issues. So I just give that one example.
Wonderful, thank you. And anybody else, the way their organizational composition structures or affects the One Health approach of their organization or beyond?
If I may again, Priya?
Mm-hmm. Yeah, of course.
Yes, thank you for asking that, and you give me an excellent opportunity to mention the call to action from the principles of the quadripartite during the last quadripartite executive annual meeting hosted by our WHO colleagues. We endorsed a call to action from our quadripartite leaders to move forward, to make One Health not only a nice principle, but something to be implemented in the field. So we developed, and we also endorse a guide for our members. And now the challenge is to implement in the field. That means that we need also our members need means, need staff, need guidance to implement. And again, we come back to the political support at global, regional, and national level. Over to you.
Mm-hmm. Thank you so much, Jean-Philippe. And final just opportunity for anyone else who hasn't spoken to answer that, or any burning interventions. Okay, in that case, we are drawing to the end of our time, and I really appreciate everybody, audience and panel, giving their extra time for this extended edition of the EPI-WIN webinar. I think that was a nice point to end on, Jean-Philippe, because it's covered really our aim for this webinar, the series, but also the way that the panelists have responded, that we really wanted this to be very practical. Like, not just the kind of theory behind One Health, which many people are aligned to, but how is One Health actually practically being implemented? And we've talked about some of the challenges of that, the resourcing, the bringing together of the different agencies and beyond, the data, the research we just touched on, also the communication and how different communities and different levels are engaged. So I think for my part, at least, I think this webinar, we've really tried to focus on the practical and the concrete, and hope we've answered some of your questions. As I mentioned, we're very sorry that we haven't been able to get through them all, but it just shows what fantastic engagement we had, and they really will feed into the design of future webinars around this One Health topic. So I will wrap up now by saying thank you very much to all of our panel today, Maria, who has left, but wonderful moderator, our interpreters, the WHO colleagues who've worked on this webinar, so Winnie, Ophelia, Brian, the EPI-WIN team, so Luby, Dongfeng, Anton, Andre, Supriya, Tim, overseen by Dr. Sylvie Briand. And obviously, finally, massive thank you to all of you for coming, for staying for this 90-minute extended webinar, and your really fantastic questions. As Sylvie, Dr. Briand mentioned at the start, collaboration is really key for EPI-WIN as well as One Health, and all of your inputs and engagement are really valuable, and we will take that forward. The recording of this webinar will be available at the EPI-WIN website, and I can see the link has been posted in the chat. And if you want to keep updated on future EPI-WIN webinars, please subscribe to our mailing list, and the link should be in the chat as well. This webinar launched the One Health series, but we have done a couple kind of out of time. So we did a webinar on plague and chikungunya in the last month, so you can catch up on those. And the recording for this one, as I mentioned, will be uploaded shortly. So we hope you'll join us for our next webinar. The details will be posted shortly on the website and sent to the mailing list. And then just a final ask is, we have a survey at the end of the Zoom, and we would really appreciate if you could just take a minute or two, it's very short, just to give your thoughts, because again, this is a collaborative platform and we'd really like to improve and hear your comments, really. So that's all for me, and all that is left for me to say is thank you all again. Have a lovely day, and we hope to see you in these future EPI-WIN webinars discussing One Health, but also other issues.
Yeah.
So
and Priya, it's just important also to say that EPI-WIN webinar on Wednesday. So it's WHO Wednesday webinar, WWW 3W. So please remind this, and it's at lunchtime so that we can fit any time zone on Earth. So thanks a lot, everybody.
Yeah, thank you, Sylvie. And details posted shortly for the next one on Wednesday. Thank you. Bye, everybody.
Bye-bye.
Bye.
Bye-bye.
Thanks a lot.
Thank you.
Bye.
Thank you. Bye-bye.
Bye.
Bye bye.